For a case of an annual physical, we'll use our technique of pre, present, and post to break down the visit. Starting with the pre column, we'd like to find out if there are any pre-existing problems or pains. Using our mnemonic old cards, we'll note the onset, location, duration, if the pain has been constant or is it more intermittent. If that's the case, we'd like to note the frequency. That is, how long does an episode of pain last, and how many episodes have you been having per day or per week. And then next we can note the progression. Do the episodes appear to be occurring more frequently or more severely? Or if there has been no progression, we'll also state that in our patient note to show that we've asked. Characterized pain, we like some descriptors, or for bodily fluids, we know by now to use our mnemonic A, B, and C to write down for our patient note the amount, if there's any blood, and the color. Aggravating and alleviating factors, radiation, treatments tried, and severity on a scale of 1 to 10. Presently, we'd like to find out if there may be any subtle changes and ask our patient permission to do a review of symptoms. Starting systemically, we'll ask about a fever, change in weight, travels, or sleep. And then working our way from the head to the bottom, we'll ask about any headaches, change in vision, change in hearing, upper airway symptoms or any nose or cough, lower airway symptoms, shortness of breath, chest pain, palpitations, abdominal pain, change in bowel movements, nausea or vomiting, a change in urination or urethral discharge, and joint pain or skin changes, including hair loss. And we could also note here the diet and exercise routine. On the post side, for completeness, I've included the vaccines, although it won't be necessary generally for an OSCE. And the screening guidelines for the United States Preventative Services Task Force. For all cases, we could order CBC, serum electrolytes, BUN creatinine, and TSH-T4. And then depending on our patient demographics, for breast cancer, a female patient from 50 to 74 years old, every 2 years we can add a mammogram. For cervical cancer, a female patient 21 to 65 years old, every 3 years we can do a pap smear. For colorectal cancer, if our patient is 50 to 75 years old, every 10 years, or 10 years before cancer was found in a family member, we'll order a colonoscopy. For diabetes screening, if our patient is 40 to 70 years old and overweight or obese, defined as a BMI greater than 25, which could be given to us in our vital signs, we'll add an A1C. For HIV, your average low-risk adult, 15 to 65 years old, will order one time an HIV antibody. Lipids, if our patient is 40 to 75 years old, we'll do a lipid panel. For osteoporosis in a female patient greater than 65 years old, we can order a DEXA scan. For a smoker between 55 and 80 years old that has a 30-pack year smoking, we'll add an annual non-contrast CT of the chest. And a smoker that's 65 to 75 years old who's ever smoked and they did not have previously their ultrasound of their abdomen, will add a one-time ultrasound of the abdomen to screen for aortic aneurysm. And for a sexually active female less than 24 years old or with a new partner or greater than one partners, we'll order a nucleic acid amplification test for gonorrhea and chlamydia. And this is to screen for PID because an asymptomatic case of gonorrhea or chlamydia can lead to pelvic inflammatory disease.
We'll start our neuro exam with hand sanitizer, and we want to ask our SP if we have permission to examine them.
Yeah.
Okay, and we're going to start with a hint exam, and we're going to use it as a guide to help us out. So for the head, we could comment that it's normocephalic, atraumatic. We'll look into his eye, make a comment that there's no scleral icterus, and look down, please. Okay. And we don't see any conjunctival injection. We'll move on to the oral pharynx. So we'll use a tongue depressor here. The key thing to do is you don't want to add too much pressure for the SP, so just very lightly you can press down and ask them to please stick out your tongue. Okay, and we'll comment that we don't see any lesions. So we'll move on to lymphadenopathy. So we're going to go ahead and inspect his cervical lymphadenopathy. So we'll start over here. Next, we're going to go ahead and do submandibular, submental. Okay, we're going to do preauricular and postauricular, do occipital, and we want to do supraclavicular. So please shrug your shoulders. Okay, good. We'll examine his thyroid, and so another good tip is to offer a glass of water. Would you like a glass of water? No. Okay, and now we could look to see if there's any visible lesions to the thyroid, and we don't see that, so we could ask him to swallow, and we could do one side at a time. Okay, now please swallow again. Okay, we didn't feel any palpable thyroid nodules. Transition to the cranial nerve exam. For cranial nerves, 1, we don't really assess cranial nerves, so we could kind of use that as a hint or as a placeholder to test their alertness and their awareness. So we could ask them, what is their name?
Kelechi.
And where are we right now?
The clinic.
Okay, good. And what time of day is it right now?
Afternoon.
Good. So now we could verbalize that they were alert and oriented ×3. We could transition to the rest of the cranial nerve. So for cranial nerve 2, ask them to look straight ahead, and we're just going to check their pupillary constrict the response, and then we're going to do the same thing on the other side. We're going to do the same thing here, and then we're going to do it on the other side. Good. Now we could verbalize that they were pearl, pupils were equal and reactive. We're going to transition to cranial nerve 3, 4, and 6. So please, you'll instruct them to please follow your fingers with their eyes, keeping their head straight, and you can see that he's able to follow. Okay. Trigeminal nerve, cranial nerve 5, and we're going to assess this with sensation. So please close your eyes and let me know if this is equal.
Mm-hmm. Mm-hmm. Mm-hmm.
Okay, good. So for cranial nerve 7, we're going to go ahead and ask him to please smile, puff out your cheeks. Okay, don't let me pop them. Close your eyes real tight, don't let me open. Cranial nerve 8, and we'll ask him to please close your eyes and let us know what side you hear this.
Left.
Okay, you hear this louder on your left?
Yeah.
Okay, good. So that would be a concern now if he has hearing loss on his right hand side. So continue with cranial nerves 9 and 10. So you could ask him to say, ah, please. And we would try to stick out your tongue, and we would visualize that we could see a non-deviated uvula. And while he's out here, we could also ask him to move his tongue left to right, and we could say that his hypoglossal nerve, cranial nerve 12, is intact. And now we will finish up with the cranial nerve 11. So please shrug your shoulders. Okay, so they are equal. And look that way and resist me. Okay, and look this way and resist my movement. Good. And now we're going to continue with MRCP. So for motor strength, please make a muscle for me. Okay, and resist me. So 5 out of 5, full reflection, and extend 5 out of 5 on extension. Great. Now we're going to do sensation to light touch. So please close your eyes and let me know if you feel this equally on both sides.
Yes, I do.
Okay. Now we're going to do a pinprick. So please let me know if you feel this on your left.
Oh, yeah, I feel it.
Okay. Now we're going to do the same thing on your right. His reflexes. So we're going to look at his biceps reflex. We'll place our thumb on his biceps tendon, and this would, his normal reflex would produce a 2+ response. Okay, and if we were concerned for a case of B12 or hyperreflexia, he would have a 3+ response. Okay, you would see that. Assess his radial pulses as well. So we could do 1 at a time, 2 at a time if you're more comfortable, and we'll verbalize that it's a 2+ pulse, regular rate and rhythm. After we completed the MSRP for his upper extremity, we can now move down to his lower extremity, and we could do the same thing. So for motor strength on the lower extremities, could you please kick out? Okay, good. So that's 5 out of 5. Now could you please kick in? Good, 5 out of 5. Now we'll go into sensation. So please close your eyes and let me know if you feel this equally on both sides.
Yes, I do.
Okay, great. And now we're going to go into pinprick. So this is a pinprick. I'm going to start on your left side, and please let me know if you feel this all the way down.
Yes, I feel it.
Okay, and now I'm going to go onto your right side, so please let me know if you feel this.
Yes, I do.
We could instruct him to relax, and we'll do a patellar reflex. So a normal patellar reflex would be like 2+, and then if we were concerned like hyperreflexia or B12, we would get a hyperreflexive response. So just relax, and you would see something like this. And we can continue to demonstrate with the tap on his Achilles tendon. So we'd start right here, and we would get a normal reflex, and if this was a case of B12 and we were concerned about hyperreflexia, he would give us a dramatic response. Okay, you feel that. We could also test while we're down here a Babinski, so we could start on the bottom of the sole and go into the big toe. And note, if he had a positive Babinski, his toes would curl up. For the pulse, we're going to go behind the medial malleoli, and we'll feel for the pulse, 2+ pulse. And then we could do the same thing on the left extremity and verbalize we have a 2+ bilaterally. Okay, now that we've finished with the lower extremity, we'll go ahead and hand sanitize again. And we'll ask our SP if they could please stand up and walk straight. And come back. We'll go ahead and listen to the heart sounds. The mnemonic we want to use is apartment M225A. That stands for the aortic, so we'll check that aortic first in the second intercostal space on the right. And then we're going to go to the pulmonic side. bicuspid. And then we're going to go to the mitral. And if this was a female patient, a tip you could use is please lift their breast up. Okay, we could make a comment that we heard a regular audible S1, S2, no murmurs, rubs, or gallops. Start off listening, we'll switch it over to the bell, and we'll use that to listen above the clavicle. And the instructions you want to give is, when you feel my stethoscope, please breathe in and breathe out. Okay, so now we can make a comment that we heard clear breath sounds, no audible wheezing. Once we concluded the cardio and pulm exam, we could cover him up again. Now we can instruct him, I'm going to now lie you down to do the abdominal exam. Is that all right? Okay, so we want to help them down. And you don't want to forget to extend the legs for the leg rest. Now you can rest your legs. For the abdominal exam, they'll have a gown here, and you want to move it up all the way to their pelvis, and then you want to ask permission to take it up. Okay, good. We'll inspect first, and we'll comment that there's no visible lesions. And ask him if, do you have any pain at all? Okay. So we'll use the diaphragm of the stethoscope to first auscultate in 4 quadrants. Okay, we can make a comment that there's normal active bowel sounds. And then the next step is to percuss. So we can percuss again in those 4 quadrants. Okay, and since he indicated that he has no pain, we could start anywhere, and the first thing we'll do is we'll start superficial palpation. So we could do that with just one hand, and do that very lightly. We'll try to go in 3 lower quadrants. So we'll do the 3 bottom quadrants, and we'll ask him if he has any pain, and you could also look to see if he winces at all. So you keep your eyes on his eyes. Okay, good. And now I'm going to transition to deep, and for deep you could just do hand on hand. And you could do the same thing. Let me know if you have any pain. We'll do 3 quadrants. Okay. If they had no pain, the last step we'll do is we'll check for hepatomegaly. And so a good way to do this is place your hand under his liver span, and you can instruct the patient to please breathe in, and once they breathe in, as they breathe out, you'll move your hand to the lower edge of his rib cage, and as long as you don't feel the liver extending below that rib cage, you can make the comment that there was no hepatomegaly. That concludes the abdominal exam, so you could help cover them again, and then sit them up, because it helps sit you up. Okay. And then you just want to ask them if they have any questions for you.
Yeah, no.